Hello, and everyone, thank you so much for joining us today. The Ambry team has had a very exciting Breast Cancer Awareness Month. It's October with many fun and educational events, and we are thrilled to be ending the month with a bang with today's webinar. We have two wonderful speakers for you today who are going to share with you powerful information about genetic testing in young, high-risk women. Our first speaker is going to be Lindsay Avner. Lindsay is the founder and CEO of Bright Pink, a national nonprofit on a mission to save women's lives from breast and ovarian cancer by empowering them to be proactive at a young age. She created this organization after her own genetic testing indicated that she carried a BRCA1 genetic mutation, increasing her lifetime risk of breast cancer by up to 87% and her lifetime risk of ovarian cancer by up to 54%. Lindsay became the first woman in her family to ensure that she would not lose her life to breast cancer by opting for a risk-reducing mastectomy in 2006 at the age of 23. She was inspired to teach other women how to take control of their breast and ovarian health and to transition a national conversation about breast and ovarian cancer awareness to life-saving action. Bright Pink's innovative programming educates young women on the prevention and early detection of these diseases and is changing and saving women's lives on a daily basis. Lindsay, we're ready for you. Thank you so much.
And thank you to everybody for joining and giving us your lunch hour. It is such an honor and pleasure as we head into rounding out October, which we at Bright Pink have decided to rename Breast Health Education Month, because we really believe that while awareness has peaked, what we need is for women to be more aware and to make sure that they're taking that awareness and putting it into action, and that's what everything is about. So what I'm hoping to do today is introduce you a little bit more to my personal story, walk you through how Bright Pink came to be, how we're different within that sea of pink, and what programs and services we currently offer both to general population women, so women between the ages of 18 and 45, but also those at high risk. And then what I want to do is spend the meat of the presentation actually talking about what are the rules of engagement, so to say, when you're dealing with high-risk or potentially high-risk women? And I think that that's going to be hopefully what sets us apart. We'll talk about some resources Bright Pink has, and then we are so blessed to have one of our support ambassadors, Leslie Jacobs, who is high-risk herself, on the line to share with you a little bit about her personal story. So totally an honor to be with Leslie, Laura, the whole Ambry team, and obviously all of you. So with that, let's jump in and get started. My story starts with the picture that you can see off to the left. This is a picture of my grandmother and great-grandmother, and they were amazing women. Amazing women who I never had the opportunity to meet because they both lost their battle to breast cancer only 6 days apart at the ages of 39 and 58. On the picture on the right, you can see there's my mom. She is an incredible woman who actually fought both breast and ovarian cancer, fought breast cancer in almost 20 years ago, and 10 months later realized that her stomach was distending, and sure enough was diagnosed with early stage ovarian cancer, and that was almost 20 years ago. So in addition to my mom, 10 women had been diagnosed, or 10 women had died of breast and ovarian cancer. My mom had been diagnosed. And I always felt as though the challenges that my family endured were ones that felt in some ways as a teenager, you feel as though they're unique to you. And yet, as you get older and more mature and you have that kind of sense, that you realize that everybody has challenges and that mine are no different than any other families. We in our family just happen to know what's causing all of this. So at the age of 22, after graduating from the University of Michigan, I ended up testing positive for the BRCA1 mutation. And for those in the line who don't know, basically this is a mutation that indicates up to an 87% lifetime risk for breast cancer and up to a 54% risk for ovarian cancer. And I was devastated, and I felt really, really bad for myself. I thought, haven't we been through enough? It feels like this is just another challenge. All of a sudden feeling as though my fate was kind of in front of me. Whatever happened to, what would happen with it, my dreams for a family and a career and a full life, all of a sudden that felt as though that was compromised. And yet it was through that experience that I realized that the challenge I faced was only the tip of the iceberg. So there was greater challenges that existed, and challenges that are meaningful and important for each and every one of us. The challenge is that we live in a world where we know at least 1 in 8 women will develop breast cancer during her lifetime. It's the leading cancer diagnosis in women, and we know that at least 1 in 67 will develop ovarian cancer. And we all know that ovarian cancer is the deadliest gynecologic disease, and only two-thirds of women who are diagnosed with this disease will die as a result. And yet, when you can look at those statistics, it can feel very startling. But at Bright Pink, everything we do is about finding the bright side. But before I do that, I want to let you know that we recently conducted a brand awareness survey. And in that, what we did is we asked women in our target demographic the basics. We asked them to let us know what they knew and what they didn't know. And we were shocked to find out that the majority of women don't actually monitor their breasts for changes regularly, or they don't know what they should be doing. They don't realize that taking oral contraceptives for 5 years can have a powerful impact on reducing their ovarian cancer risk. They don't even know what they should be asking their doctor, and many aren't even going to their doctors. But at Bright Pink, we believe that that's only part of the story. For there is a bright side, and I think in a world where there's so many problems that exist, we're so fortunate in a situation like this to have what we consider to be a solution. And the bright side here is that we know when caught early, the 5-year survival rate for both breast and ovarian cancer is greater than 92%. We also know that breast cancers in young women are often diagnosed by the young woman herself and then confirmed by a doctor. So 80% of the time, all the research points to early adulthood as being the critical moment to impart these strategies and help women to live by them and to last a lifetime. You can see on our personal survey we did, 2/3 of women said that they would wanted to make lifestyle changes if they knew what they were. And so we really looked at this as a tremendous opportunity. So for a moment, I want to go back to my personal story and talk a little bit about what I was facing, after testing positive for this gene. I felt extremely alone. I felt as though while so many women were wrestling with the day in and day out of their family and people my age were just starting their career and thinking about stuff that 22 and 23-year-olds think about, all of a sudden I was playing a game of defense like I'd never played before. And I've never been somebody who plays a game of defense. For me, it's always been how do we get on offense as soon as possible. And I made the decision back in 2006 to have a risk-reducing double mastectomy. And at the time, I was the youngest person in the country to opt for it. And what I realized from that is that all of those challenges that we talked about, how pervasive, how deadly certain ones of these cancers are. And yet all that we could do, it became unbelievably clear that there was a gap out there, that there was something missing when it came to young women and inspiring them, educating, equipping, and ultimately empowering them to be proactive advocates for their health. And that's what Bright Pink does. As Laura mentioned in the intro, we are on a mission to save women's lives from breast and ovarian cancer by empowering them to live proactively at a young age. And our target demographic is the 52 million women in the United States between the ages of 18 and 45 who we say have the power to be proactive, to reduce their risk of developing breast and ovarian cancer or prevent these diseases at early, non-life-threatening stages. And how do we do it? Well, we have a two-pronged approach to our education. Our education is a key focus. We go and reach young women through Brighten Up educational workshops, which I'll talk about in a second. And then we also reach their doctors through our emerging medical professional workshops, which I'll talk about in a second. The other thing I want to point out is that we also believe in equipping women with the tools they need to not just think about this in October, or not just think about this once, but to live these strategies, to have Bright Pink come to life, to live the Bright Pink way of life year-round. And one of them is our breast health reminders. It's actually a monthly text message to encourage women to be breast health-aware. And for everyone who's sitting there with their phones by you, I would encourage you to pull out your phone, text PINK to 59227, and voila, you'll get a once-a-month reminder to treasure your test. So the first one I want to talk about on our educational platform is our Brighten Up educational workshops. And what we do is we go into companies, we go into sororities, we go into community organizations or religious institutions like churches or temples, and we have certified ambassadors who deliver a 20-minute workshop on the breast and ovarian health basics. And it all culminates with asking every single woman to go visit assessyourrisk.org and complete Bright Pink's initial risk assessment tool. What's so fantastic about this tool is it helps give women the instant gratification they need as if they were taking a cool Cosmo quiz, but it also marries lifestyle with family health history information to give them a sense of, okay, you could be in this average risk category, and here's all that you need to do, or you potentially might be an increased or high risk, and here's what you need to do, here's how you can find genetic counselors. We're really proud this tool is certified by NSGC, which is a really unique opportunity for us. The second prong of our educational strategy is reaching the next generation of doctors and many who are already existing in practice. So after piloting this program for 2 years at Northwestern and NYU, we proudly did the national launch of this program just this fall and are so proud to have reached more than 820 OBGYN, internal medicine, family medicine, and women's health nurse practitioners residents. So our whole focus is on reaching the OBGYN residents, the internal medicine residents, and making sure that we're imparting the strategies so that they can properly stratify risk for their patients and also manage it accordingly. And that is everything that this program does, and it does it unbelievably successful. We have been really proud to present at Harvard, Hopkins, GW, Howard University, Northwestern, NYU, all across the country, and to be having the impact we want, which is women who are empowered, meeting doctors who are empowered, and ultimately that's what we believe leads to life-saving action. Just wanted to take a second and just draw your attention to this. This is kind of what our Assess Your Risk tool looks like. This is a fantastic tool that is offered for young women who just want to start understanding the lay of the land. What does all of this mean? How does this all fit together? And I think this is something that we hope every single woman in this country will complete. What's so great about it is it also at the very end summarizes all of the inputs and can be downloaded into a PDF for a woman to take to her doctor or genetic counselor and to start the conversation. We've had 26,000 completions just in 2014 alone of this. We're hoping to have hundreds of thousands next year and millions in the years to come. So you can play a special role by helping share with the women in your life, your patients, anyone, assessyourrisk.org. I'm going to breeze through quickly these slides because I know there's a lot of people who know this, but just a quick refresher that there are 3 levels of risk. We know that there's this average risk group, and that's what we were talking about, the 1 in 8, 1 in 67. There's also the familial risk or the increased risk group. So women who have that first-degree relative with breast or ovarian cancer or a personal history of any sort of abnormal breast biopsy. And then there's the high-risk group, ones that me and my family fit within, those who have a known genetic mutation. And just to review, we know that average risk women, the risk 12% for breast cancer lifetime and 1.5% for ovarian cancer. That increased risk, really important that we're identifying who these women are. Really, really, really important because they need to do more as well and work with their doctors to figure that out. We know their breast cancer risk can be up to 25%, up to 5.5% risk for ovarian cancer, and obviously the high risk is substantial. And sometimes I think it's easy to just focus on the high-risk category. And yet it's so important that we remember that 75% of breast and ovarian cancers are actually occurring in the average risk group. So Bright Pink, our goal is making sure that we put people in the proper risk category, but ultimately that they start acting accordingly. So with that, let's move into some rules of engagement. So this is collected. I had our team look back at several, we've had the honor of being a part of thousands of high-risk women's journeys over the years, and this is what they've told us. So this is not, I want to be clear, this is not the Lindsay Avner point of view on this. This is what all of the women in our network who've endured this, who've gone through this, have told us. So I'm going to be talking on their behalf and taking some liberties here, but I just want to let all of you know that this has been pulled from this network of women who know exactly what they want. And this section is going to be really geared towards the genetic counselors and the practitioners on the line who are dealing with these women day and night. So I think first and foremost, the thing to remember is when you are giving somebody a genetic testing result, particularly a positive result, their life will never, ever, ever be the same. And I think that sometimes that's what's so beautiful about the work each and every one of you do, but it's also what makes it so loaded, right? Having a bad day could be the difference between a woman feeling as though she's supported and cared for along this and not. We want to encourage all of you to be very careful with how you handle your BRCA negative patients. What we come to find out is that a lot of times, while we want women to breathe that sigh of relief when they find out they're negative, sometimes what's happening is the genetic counselors aren't doing a good enough job helping to create the urgency around prevention that they need to have, either if they are a true negative and they fall within that average risk, or if they still fit in that increased risk. Let me give a couple examples. One is when you tell a woman that you will come in and meet with her, that she's going to come back and receive her results, but if she's negative, you just pick up the phone and call her. What that sends a message to her is, it's okay, check off breast and ovarian health on your list. You don't really need to worry about those because as long as you're not high risk, everything is fine. And what we want to encourage all of you to do is remember that these women still have risk and that they actually are primed in that moment to start the strategies, being breast self-aware, being adamant about going to the doctor every year, and incorporating risk-reducing strategies. So really, really thoughtful with how we handle those BRCA negative patients. Also understanding that there's a lot of guilt that can come from the experience of finding out that people in your family have been diagnosed or died, or perhaps a sister or a relative, and here you are sitting negative. So we encourage them to reach out for support as well, and all of Bright Pink's support programs are tailored to meet their needs as well. This one I know might be a little hard to hear, but as you can imagine, everyone is trying to learn from this cohort, right? High-risk women, women who haven't been diagnosed. We're so fortunate to have them, and every institution has different research studies they're pushing. But to be clear, it is very, very daunting for women when they find out that they test positive, and then the next thing that their genetic counselor is doing is talking about all the cool research that they can get enrolled in. There's a time and a place, and we're unbelievably supportive of that. What we would just remind everyone is, again, going back to that first point, this person's life will never, ever be the same. Let's be thoughtful with how we present what research and how that looks, and allow people to feel like it's okay to be a little bit selfish, at least for a little bit of time, before they feel like, they need to just be a subject to save future women. Obviously want that. The fourth point is something that our Chief Medical Officer, Dr. Lindner, always says, and the importance for high-risk women to find what we consider a medical home. And when we talk about a medical home, as you know, there are so many needs to ensure that high-risk women are following up on the screening and the risk-reducing strategies that are available to them. But the research actually shows that if they don't have a place and someone who's helping them coordinate it, that they start to fall off, that they do not continue to go for the mammograms and MRIs or continue to see the specialists that they need to see. And so we really believe it is the role of a genetic counselor to help that person ensure that somebody, whether it's an OBGYN, that genetic counselor, a psychologist, somebody is serving as that medical home who's going to keep that patient engaged in this process in the future. And as she's kind of searching for this quote unquote dream team of people to be on her team, we would encourage you to have her date around before she commits. Sometimes it's this sense that well, that doctor was really highly recommended and I heard all these people loved him, but I didn't get a good feeling. That's okay. Make sure you get second opinions. Make sure she feels like it's appropriate to try stuff and feel like if that doesn't feel like it's the right fit, to try to find another one that is. This is something else that came in that I thought was really interesting because I haven't heard this in a couple of years, but a couple of, this was a theme that came from all of the research that we did here just to survey and prepare for this call. One of those points that women made to us is gosh, it would be really helpful if genetic counselors supported me in engaging with my family members. So, of course, we want to make sure that we're hopefully testing the person who's diagnosed before we test the unaffected patient. At the same time, now she has the implication of all of this data and this knowledge, and helping support her and how do we disseminate it and how do we make sure that other family members are kind of engaged in this process was something that she requested. If we go on to the next page, I think this is something that we just at Bright Pink believe it's in our DNA truly, and that is that there's a bright side. And I would ask that each and every one of you show her the bright side, not in like a saccharine sweet, artificial, contrived way, but in a way that helps her realize that she is so fortunate to have opportunities that generations of women didn't have before, that so many women and men obviously walking around this are predisposed to different things. It's just with BRCA, we happen to know about it. Help her see that there's things that she can do and that this isn't just finding out something and having no options, but that there's an opportunity. And I think when the genetic counselor emanates some of that bright side in a really authentic, genuine way, she feels it and it helps to propel her forward. Another thing that women said back to us is to tell them what they should expect. So if it is that they're going to be really bummed or sad or very anxious on their first appointment they go for a screening surveillance program, like help her understand what the next several weeks, months, and years entail, and the more you can help bring color to that, the more comforting it is. It's interesting because I know there's a sense sometimes for information overload, so it might not be in that first appointment, but in subsequent ones or follow-ups, really helping her to understand that it's totally normal to feel what she's feeling and to feel that tremendous anxiety before a certain appointment, or to breathe that sigh of relief, or to feel confused, or to feel torn in different directions. All of that is normal. That just allows her to put herself in the right mindset. We talked about ensuring that she remembers all the options she does have. There can be such a sense of feeling like without control and feeling as though, oh my gosh, I have no control over this. So reminding her of the areas she does have control over. Follow-up, this is something that is a personal decision for each of the genetic counselors that I would encourage each of you to think about following up with her at different stages. At Bright Pink, we will see women who come time and time again to our support programs and don't choose to have, for instance, a surgery till 4 or 5 years after. If they found out, say they were at 26 and they wait until they're 30. Having that genetic counselor, again, you just told her information that changed her life forever, and maybe putting reminders on yourself for some of those patients to give her that extra check-in once in a while, so anything I can do is so incredibly helpful. And the final point is connect her to Bright Pink. That's really what we're here for, is to make sure that she knows she's not alone. And I just want to touch on 2 of the programs we have that can help support her through this process. And really, it can be as though we're working in tangent, we're working together to make sure that we deliver for her the best opportunity to both be proactive with her health, but also to feel loved and supported and positive throughout. So the first program is our experiential outreach groups. And what these are is they're monthly gatherings facilitated by a support ambassador. And you're going to meet Leslie in just a bit. Leslie is so fantastic, and she's in Cincinnati running these. And this is for any woman who falls within that that familial risk category or the high risk, so genetic predisposition. So I want to be very, very clear. There are a tremendous amount of non-BRCA positive people that come to outreach groups. There's also some survivors. We're very clear this is not to supplement a survivor support group. We don't talk about the chemotherapy regimens and all of that stuff, but there are survivors who take a lot of comfort in attending. And what we do is we fund an incredible experience, whether it could be painting pottery, a yoga class, a self-defense workshop, a cancer-fighting food workshop. We do a beading class, learning how to knit. We do something that breaks down all the barriers and reminds women that we're all kind of on the same page, and we all have the same hopes and dreams and fears that each other has, whether it's somebody who recently lost a mom to breast cancer, somebody who's considering genetic testing, someone who tested positive, wherever she falls on that trajectory. It's a really incredible opportunity to connect her. And we'll talk in a second about where all of this stuff is happening. But I also want to talk about, because our experiential outreach groups are happening in different communities, but they are not in every city nationwide. Something that is available to every single woman who is either at high risk or increased risk is Pink Pal. And we have a licensed psychologist on staff who has developed an incredible program. There's over 500 trained Pink Pal mentors. And these are women who've gone through a certain high risk experience. What's it like for the first time your shirt comes off with a new guy you're dating after a mastectomy? Or how do I get my family to talk about our risk when everybody says, you know, in our background, no one talks about anything? How do you plan a wedding and a funeral at the same time because my mom is really sick? All of these kinds of topics are perfect to bring to Pink Pal, including I'm trying to weigh surgery versus surveillance. I'm trying to weigh this versus that, all of those things. What Liz does is she's kind of our certified Pink Pal matchmaker. And what she does is based on certain demographics and upon the request of the participant, the woman who's seeking support, she pairs her with a peer mentor or a support provider, a Pink Pal. And this program has just been incredibly valuable to hundreds of women all around the country. And we're really proud to have made over 200 matches this year alone between Pink Pal mentors and support seekers. So I would just encourage you all to check out unbrightpink.org. The I Am High Risk section has also a wealth of information, including information on fertility preservation, career, legal concerns, all these other issues that relate to being young and high risk, and just encourage as many women as possible to reach out. We also have some educational materials if you're interested in ordering under the medical professional tab on brightpink.org. You can order some information to have information about Pink Pal to give to BRCA positive patients, or our little bright books to have in the office, or to attach your business card to and leave in other places around the institution. Just some ideas. And just a final thought, I just wanted to highlight everywhere where you see the lime green is places that we have a support ambassador, and we're growing this program, so the hope is that we have many, many more. When you see the teal, that's where we have education ambassadors, so these are people who are doing those Brighten Up educational workshops, and anywhere there's pink, it means there's both. So for those looking for places to send women, if you are within either the lime green or the pink, that is exactly where these outreach groups are happening. If not, Pink Pal is a fantastic option. So with that, I just want to once again thank all of you, and I'm so excited that we get a chance to hear from Leslie. And with that, Laura, I want to hand it back to you.
Thank you so much, Lindsay. That was an excellent presentation. Both your personal story and what you've done with it with Bright Pink are really inspirational, and those tips for engagement, I think, benefit myself as a genetic counselor and many other clinicians on the line. So thank you so much for that. As Lindsay mentioned, Leslie Jacobs is our next speaker, and Leslie Jacobs is the current support ambassador for the Cincinnati Bright Pink location, and she's also a carrier of a BRCA1 mutation. Leslie was quite young when she found out about this mutation when she was 23 years old, and this was after her mother had been diagnosed with cancer for the second time. When Leslie saw Lindsay Avner on the Today Show shortly after that in November of 2011, she knew that she had to become involved with Bright Pink. Since then, she's been involved in a number of ways, and she's here today to share with us a little bit about her personal story. So, Leslie, thank you so much.
Thank you so much, Laura, and thank you so much, Lindsay. And thank you guys for including me today and providing me with a platform to tell my story. I'm really looking forward to it. So yes, as Laura had mentioned, I was quite young when I found out that I was BRCA1 positive. Much like Lindsay, I was 1 year older. I was 24, and this came after my mother's second diagnosis with cancer. My mother had her first diagnosis with breast cancer at the age of 34. My maternal grandmother had had breast cancer in her early 50s, and my maternal great-grandmother had had breast cancer in her 80s. So we always knew that there was a very strong family link. However, when I begun going to the gynecologist on a regular basis at 18, knowing my family history, they always, suggested and recommended that I have the BRCA testing done. I was always on board for it, even at that very young age. However, it was my mother that was more reluctant because, I'm 26 now, so that was almost 10 years ago. And, it was kind of like, what do we do with this information? There weren't bright pinks out there. There were not young, vibrant females telling their story of being proactive of their health. And, so we kind of put it on the back burner, and each year that I would go to the gynecologist, it would come up again, and I'd get the pamphlet to go get the testing done, and it kind of, again, go on the back burner. But I felt like I was being proactive of my health just in general by going to my yearly female appointments. Well, fast forward a little bit, and my mother was diagnosed with uterine cancer at the age of 53. This was in September 2011. So, and actually at that point, my mother had been very proactive herself, having had the breast cancer at 34. That was in 1992. She had preventative mastectomy on her left breast that did not have the breast cancer, where her right breast did, and she had her ovaries removed at the time. So really, looking back to that probably saved her life, being proactive back then. But, they did not have, I believe it was 1994 when the BRCA testing, and I could have that year wrong. Don't quote me on that. I know you guys are all the experts here. But, we did not have the knowledge base when she had her cancer at that early age. So fast forward to 2011, her oncologist, given the assessment of our family history and that, her uterine cancer was a secondary cancer. It was not related to the breast at all. But, that she had this cancer diagnosis again. He's like, you really do need to get the genetic testing done, especially for your daughter. So I was totally on board. And even prior to have the testing done, prior to knowing about Bright Pink, and knowing Lindsay's story, I knew that I needed to be proactive about my health. My biggest fear was being, 28, 30 years old and being diagnosed with breast cancer and dying at an early age before my life even begun. So, before, again, like I mentioned, getting the testing done, I was committed that I was going to be as proactive and aggressive as I could be about my situation. So, November 2011, I found out that I was BRCA1 positive. I was 23 at the time. And, I gave myself a couple months. Lindsay touched on that. Kind of a couple month period of time to gather my thoughts and figure out how I was going to approach this. And on the recommendation of the genetic counselor, I was put in place with a breast specialist surgeon, and my process for my surgery began in February of 2012, and I had my preventative bilateral nipple-sparing double mastectomy in September 2012 at the age of 24. So, but it amazes me how far we've come in just these past 3 years, and with the tools and the resources that are out there for the high-risk young women like myself and like Lindsay, primarily Bright Pink. I mean, I mentioned to Laura, and Lindsay knows this too, it was really divine intervention that Bright Pink came into my life. I saw Lindsay on the Today Show around the time that Juliana Rancic had been diagnosed with breast cancer, and Lindsay was there talking about Bright Pink, and this was literally, I think, right smack dab in between, it was in October sometime, I believe. So it was like in between my mom being diagnosed with cancer again and me finding out that I was BRCA1 positive. And it helped me so much to see Lindsay because, she spoke like me, she dressed like me, she looked like me. This was this young, vibrant, girl who also she was career oriented, myself being that way too, because it was only like a year and a half after I graduated from college. And And, like Lindsay mentioned, kind of getting started on life, and then you have this big monster of this genetic mutation that you have to deal with. And you literally do feel like a mutant, like at least I did. So when I saw her on the Today Show, it was so refreshing that, like, oh my gosh, here's this, quote unquote normal young female, and she's dealing with the same thing that I'm dealing with, and she's been through what I'm about to go through. So I became involved in the Pink Pal program as a recipient, and was matched with a lovely another young lady who had the surgery at a young age. And, we were just able to talk as friends, and I was able to ask her those questions. What is it like dating? How do you explain this to your friends, to other family members? How do you navigate this? And that was so helpful to me. I, of course, wanted to give back. So after I had my surgery, I actually became a Pink Pal, so I could be connected with other young women that were going through the same thing. And then it kind of evolved into me becoming a support ambassador here in Cincinnati, where I currently live. So yeah, Bright Pink completely changed my life. And I wrote Lindsay not long after I had my surgery that, I knew I would have gone through and I would have had the surgery regardless. But again, going back to that, just seeing her and not feeling like I'm this, like I mentioned the term mutant, walking around with this genetic, and this genetic disposition that I was in. So yeah, that's kind of my story. I hope I didn't jump around too much there, but.
No, that was perfect, Leslie. I will ask you, really, just what were some of the decision makers for you when deciding to do the surgery? I know you mentioned you were put in place with a genetic counselor who then suggested a breast surgeon. What did you go through to make that decision, or were you always set on having the bilateral mastectomy?
It's so funny because I have been asked that question, like, oh my gosh, that was such a big decision. You were so young. How did you decide that? And my answer is really simple, is that, like, I didn't, for myself personally, and I know that there are many ways to navigate being high risk. For me personally, I did not feel like I had another choice. Like I mentioned, I did not want to be 28, 30 years old, whatever, diagnosed with breast cancer. And I focus a lot on the breast cancer because that was, that my mom had that early. I know that, I have to deal with the ovarian cancer component of it as well. And that's another thing that I can get to, but focusing primarily on the breast cancer thing, my mom was only 34 when she had it. So I just knew, and I always knew that even as a little girl, because I was 4 at the time when she had cancer the first time. I always knew that my mom was different and my life was a little bit different than my friends because my mom had been through that. So as simple as it sounds for me, I did not feel like I had another option. I really feel like, this is what I had to do. And there were other factors that played into it. Like, I had really wonderful medical insurance at the time. That makes a huge difference. I was employed at a great company that had great medical leave. There are all those things that go into it. But yeah, it was a no-brainer. Honestly, as big of a decision it was a no-brainer for me.
Laura, can I jump in with some other stuff? I think what Leslie said was so awesome, and I think I can round it out with some of the ovarian side.
Perfect.
So it's interesting because after I got through the breast side of things, it felt as though they say just like get your ovaries out 35, 40 at the latest. And something that was really powerful for me was feeling as though, like, kind of being self-aware enough to know that, like, as I was nearing my 30th birthday, like, I absolutely was coming to a place where I was starting to make decisions in my life and was dating guys that were not incredibly wonderful, and being like, they're nice enough or they're good enough. I have to hurry because my ovaries are coming out. And I actually made the decision to freeze my eggs leading right after my 30th birthday. And it was such a powerful decision that to have the chance to make that decision at an age and be able to have a successful result. Ironically enough, I ended up meeting my now fiance 2 weeks later, which is a wild story. But I find that sometimes for women, understanding that's an option is, instead of feeling as though they have to rush their entire personal life, is really, really powerful. The other point I will say that I think Leslie said so beautifully was this concept around women who've seen their mothers have cancer are in a very, very, very different position. I think sometimes making decisions is easier because you've seen the effects firsthand, versus when it comes on the father's side, sometimes those women need a little bit extra support in kind of taking them along the journey because they haven't witnessed it firsthand. One other thing I will say, that there's so many women in bright pink who've said this, and this is such a bright pink thing to say, which I totally love, is sometimes when they consider a mastectomy, if they're BRCA positive, as a couple of scars, or it's no different than my friend who had breast implants or who had a breast reduction, it doesn't feel so challenging. So I'm not advocating for anyone to make a decision or not. I do think it's important for women to know who are BRCA positive that screening is trying to catch cancer, right? Like, so I've seen a lot of BRCA positive women who are like, I was doing everything right. And you're like, yeah, you were doing everything right. And you caught it early, but you still have cancer now. Now you have to go through chemo and everything else versus having the opportunity to reduce your risk or not develop it entirely. And so just a couple other insights, but I just want to thank Leslie so much because that's not an easy thing to do, to be so open and honest with the dozens of you on the line, but I think she did great.
Oh, thank you, Lindsay.
She definitely did excellent. I have a few questions here that I'll address to both of you. The first one, Lindsay, is similar to the question I asked Leslie, and I think that you've already answered this in some regards by having a family history of breast cancer, but you were still young when you made the decision to have a mastectomy, and there wasn't the support in Bright Pink or other organizations out there. How did you make that decision to have that surgery at such a young age?
Well, it's a good question. You know, I had originally enrolled in a high-risk screening program, and I think it was this combination kind of what I just said, this realization that I was going every 3 to 6 months for different screening techniques to actually catch cancer, but then it would be cancer, right? Like I might have to go through chemotherapy, I might have to have the impacts of cancer. And it felt as though every time I would leave a screening appointment, I breathed a sigh of relief, but then the next thing I knew, I was taking another half day off of work to meet the needs of trying to figure this out. And I just thought to myself, like, at the time I was getting horrible migraine headaches. The anxiety was getting the best of me. I'd reached out to several organizations that focus on survivorship, and they actually resented. They kept saying to me, like, you're fine, like you don't have cancer. And I was like, right, but I don't feel like I'm like everyone else. I feel totally different. So I think for me, it was just powerful, the idea of, again, moving from defense to offense. The other thing I will say is, of a couple of my college friends, I laughed at one of them who has had breast implants, one of them has had a breast reduction, and the other one had a breast lift. And she definitely did not need a breast lift at 23 or whatever. But I think there was something pretty interesting about this concept of women choosing to have scars and to have breast modifying surgery on a day-to-day basis. And this is something that could help have such a powerful impact on my future, who can lift the cloud that felt like it was following me, and ultimately put me in a position to hopefully be the first woman after so many generations to one day have a daughter who doesn't have a mom who's sick with breast cancer. That's an amazing, amazing thing. So sometimes I think it's as simple as flipping the situation, not considering it a quote-unquote mastectomy because that's so scary, but a couple of breast scars, or not thinking about all that you don't have control of, thinking about what you do have control of.
Well, that's an excellent way to look at it. And the point of saying women choose breast scars and modifications on a daily basis is such a good way to flip it and help people make that decision in a much less scary way. I really appreciate you sharing that. That's something that I've never heard before. I'm going to switch back over to Leslie with a very personal question probably. You had mentioned, Leslie, that you could touch base on kind of the plans for your ovarian risk. And I know Lindsay spoke on freezing eggs and how powerful that is because it doesn't require you to rush your personal life. Are you willing to give us any insight in what your thought process has been on that cancer risk?
Sure, absolutely. I mean, obviously, being that I'm BRCA1, I do know my risk, which I'm very fortunate of. I am 26 years old right now, so I go for my yearly screenings at the OBGYN. And my approach, tackling the breast thing was such a big thing for me that my approach right now is I'm on top of it. I take oral contraceptives and have for over 5 years. So, again, with the screenings and taking the oral contraceptives, I'm doing and also just living a healthy lifestyle in general. I'm doing what I can be doing right now to be proactive. In terms of, freezing my eggs, I am still looking for Mr. Right. So, that's definitely something that I, need to think about. And like Lindsay mentioned, her target time frame was kind of 30. I feel like right now I'm kind of buying myself a couple years. And again, this is something everybody deals with different. It's not like I'm putting it on the back burner per se. It's like, hey, I'm going to deal with this. I'm just choosing not to maybe address it right at this minute. I want to kind of see where life takes me the next couple years and go from there. So that's my approach, and everybody is different.
Excellent. Thank you so much for sharing that.
Oh, sorry. And along those lines, yes, I will get my ovaries and my uterus out. My target time frame is between 35 and 40. So yes, that will be addressed down the road.
But in a long time, you got a lot of time in between now and then, I think, as well.
Yes. Yeah.
So I have one more question for Lindsay, and then I'll let each one of you make any additional comments you'd like at the end. But Lindsay, when you were talking about the rules of engagement, you mentioned something about research, and research is becoming more and more a part of our lives as a genetic counselor and as a provider to patients with mutations. And not only just BRCA, we have all of these other mutations that we're testing for as well. And finding out what they do and what those risks are so important to our field right now and to our patients. What would you suggest is the best way to bring up research that's still sensitive?
That is such a good question. I'm glad you mentioned that because you're right. Like, this is so incredibly important. And there always will be those kinds of people who are just like, yes, use me. I am at service to you. I was a good example where I actually, when it was brought up in one of my first surveillance appointments, I was totally offended. I was like, here I am having all of these migraine headaches. I'm like trying to wrestle with this. I'm 23 years old. And like, I'm sorry, like in a typical 23-year-old manner, I was like, allow me to be a tiny bit selfish right now, right? So I think sometimes it's just about giving it the time and finding the right opportunities versus just uncovering the results and then saying, okay, go into this, go into this, go into that. That's also the other opportunity around follow-up. That's a really good way also to show the bright side, but once somebody has digested it. So as you're checking in with a patient, so to say, use that as an excuse. Hey, I was just in this research thing. It's, there's so much we can learn about. No pressure. If you're interested, I would love to have the chance to enroll you. But more than anything, I just want to check in with you. How are you? What can I do? Do you have your medical home? What's going on? So I think it's just more using those tangible ways of engaging with her so that she doesn't feel as though she already, to Leslie's point, feels as though she's a mutant and now everybody just wants to study her. Does that make sense?
Definitely. Yeah, I think it's a fine line, and introducing it in the most sensitive way is so important to us. We want people to participate in research if they're willing, but by no means do we want to offend anyone. Awesome. Well, I really appreciate both of you giving up your time today to present this information. I think we learned a lot about Bright Pink and a lot about ways to interact with young women who are undergoing the genetic testing process or who have mutations in any one of a number of breast cancer-related genes. Would either one of you like to say anything else to our audience before we end the call?
I just want to say, this is Leslie, I just want to say thank you again, Laura, and thank you all for letting me share my story with you. And thank you so much, Lindsay. You really, truly changed my life, and you and Bright Pink. So that's all that I have to say.
Leslie, you are a total joy. And I would say there are probably a lot of you on this line who know incredibly attractive single men, and Leslie is the biggest I can ever imagine. So, always am trying to work. You know, I had one marriage a couple years ago, and it's made me a little cocky. I think I've become good at this matchmaking thing, but my fiance always laughs. He's like, honey, you can't just set everyone up with everyone. So, but no, I would just thank you all so much, and thank you for the work you do each day, and thank you for the hunger and the thirst to continue to learn and evolve. We look at ourselves as partners with you. Reach out to us, get educational material, get involved in our programs. Most importantly, know that we're in this together as we're serving the patients and the young women that you're seeing. And just remember those rules of engagement we talked about, because I think that they're, even if you've been practicing for many, many years, they're really, really important reminders that might seem obvious, but to the woman on the other end make all the difference. So huge thanks to Ambry, to Laura, to our incredible Leslie, and obviously to all of you.
Thanks, guys. Everyone have a great afternoon, and we look forward to seeing you on our next webinar. Take care.